There's a strange thing that happens. Many older adults go to sleep feeling completely fine and healthy, but the next morning, they never wake up. Families often think of this as passing away in their sleep, but the heartbreaking truth is much more complex. It could be an undiagnosed nighttime stroke. A stroke doesn't always come on with a bang, with a drooping mouth and half-body paralysis like you see in movies. In older people, especially those over 60, a stroke can arrive very silently while you're sleeping. No screaming, no severe pain, just small, subtle signals that are easy to miss. Have you ever woken up with a slightly numb arm or felt fleeting nausea or confusion in the middle of the night? Many people think these things are normal, but to your brain, it could be the final warning. In this video, I will share 10 silent signs of a nighttime stroke. Signs that, if you recognize them in time, could save your own life or a family member's. Stay until the end of the video, because just one small detail can be the difference between life and death. Sign 1, partial vision loss. Imagine a morning just like any other. As you open your eyes after a night's sleep, suddenly one of your eyes goes blurry, or it feels as if a curtain has dropped across your vision. Most people who experience this would simply think, "My eyes must be tired. I'm not fully awake yet," or "It's a vision problem." They decide to wait and see if it gets better. But that hesitation is a deadly risk. Sudden partial vision loss isn't a problem with your eyes. It's a warning bell that your brain is experiencing an acute lack of blood in the occipital lobe, the area responsible for processing images. When the blood flow that carries oxygen and nutrients to this area is blocked, the nerve cells in the visual center begin to die every second. Without immediate medical intervention, the result could be permanent vision loss, meaning you'd have to live in darkness for the rest of your life. The crucial thing to remember is that vision doesn't just suddenly disappear and then safely return on its own. If it disappears for a few minutes and then comes back, it could be a transient ischemic attack, a form of mini stroke. Statistics show that nearly half of all people who have a major stroke have already experienced a mini stroke in the week prior, but they ignored it. Therefore, if you or a loved one suddenly experiences blurry vision, double vision, or a dark shadow covering part of their sight, don't wait. Don't hope it will go away. This is the moment you need to act immediately. Call for an ambulance and get to a hospital as soon as possible. Because in a stroke, every minute is the life of millions of nerve cells. Tamu, and it's your chance to save the light in your eyes. Sign 2, inability to speak clearly. Imagine this. Someone asks you a simple question, like, "How are you?" You open your mouth to answer, but what comes out is a jumbled, distorted string of sounds that makes no sense. In that moment, many people would think, "I must be tired, sleepy, or have a sore throat." However, this could be a signal that your brain is crying for help. The ability to speak and express language isn't located in your larynx or vocal cords. It's controlled by a specific center in the brain, often called the Broca's and Wernicke's areas. When a blood clot blocks blood flow to this region, the nerve cells are instantly shut down. The result is that you can't form words into sentences, or you can't understand what others are saying. This is a condition called aphasia, one of the clearest and most dangerous signs of a stroke. What's even more dangerous is the confusion. Many people and their families often ignore a brief moment of slurred speech, thinking it's due to fatigue, drinking alcohol, or old age. But remember, a sudden new onset of stuttering or slurred speech is a warning that the brain is being severely damaged. If left untreated, this condition can cause you to lose your ability to communicate permanently. However, if you're taken to the hospital within the first few hours, doctors can use medication or perform a procedure to break up the blood clot and restore blood flow to the brain. In contrast, even a slight delay means millions of language cells will be lost forever. Sign 3. Facial drooping on one side. Along with speech, the ability to control facial muscles is also one of the areas most vulnerable to a stroke. Imagine this. You look in the mirror in the morning and smile as you normally would. But your smile suddenly becomes crooked. One side of your mouth droops, and your cheek looks like it's being pulled down. Or when you try to close your eyes tightly, one eyelid won't shut completely. This isn't temporary fatigue. It's a direct result of the brain losing the ability to control facial muscles. Deep inside the brain, there are bundles of nerves responsible for transmitting signals from the cerebral cortex down to the facial muscles. When a blood clot blocks the blood supply to this area, the signals from the brain can't get through. The facial muscles immediately stop receiving orders, lose their tone, and lead to a drooping face, sagging mouth, and a crooked smile. Medically, this is called central facial paralysis, a classic and extremely clear sign of a stroke. The danger is that many people confuse this condition with peripheral facial nerve paralysis, which is often caused by cold, inflammation, and is less dangerous. But there is a crucial difference. Facial paralysis from a stroke is almost always accompanied by other signs, like difficulty speaking and weakness on one side of the body. In contrast, peripheral facial paralysis only affects the face. Recognizing this difference can be a matter of life or death. So if you or a loved one suddenly experiences facial drooping, treat it as an urgent signal. Don't hesitate. Call for emergency help immediately. Because the chance for recovery is still there, but only if you seize it within the golden time window. Sign 4. High blood pressure at night. After discussing 3 obvious signs related to your eyes, voice, and face, we will now turn to a much more silent, yet extremely dangerous one: blood pressure that doesn't drop while you sleep. Normally, our bodies operate on a circadian rhythm. During the day, our hearts and blood vessels work at a higher intensity, and blood pressure increases to meet the demands of movement, thought, and work. But when night falls, your brain and body rest. Your heart slows down, and your blood pressure should naturally drop by about 10 to 20%. This is called dipping, a healthy and natural reduction in blood pressure at night. However, in many people, especially after the age of 60, this phenomenon disappears. Their blood pressure remains high throughout the night, as if you're forcing your body to run a marathon in its sleep. When this happens, the walls of the blood vessels are constantly strained and under pressure. Over time, the inner lining of the blood vessels wears away, creating a prime environment for plaque to form and blood clots to appear. This is the silent mechanism that pushes you closer to a stroke. Modern medicine has shown that people whose blood pressure does not drop at night have twice the risk of stroke and heart attack compared to those with a normal dipping pattern. In particular, these events often occur in the early morning, right as you wake up, when your body is transitioning from a state of rest to activity, and your weakened blood vessels are even more vulnerable. So, what should you do? The only way to detect this condition is to ask your doctor for a 24-hour blood pressure monitor. This specialized device will record every fluctuation in your blood pressure throughout the day and night, helping to detect if your blood pressure remains abnormally high at night. Remember that sleep is when your body recovers. If even during sleep your heart and blood vessels are straining, it is as if you are pushing your brain closer to a stroke. Sign 5. Unusual arm weakness. After discussing high blood pressure at night, a silent enemy, we now move on to a much clearer and more unmistakable sign. When one arm suddenly becomes unusually weak. Imagine this. In the morning, you walk into the kitchen and, as usual, reach for your familiar coffee cup. But today, your arm suddenly feels heavy, unresponsive, and drops, nearly causing the cup to shatter. The feeling is strange. You want to move, but your body betrays you. This is a classic symptom of a region of the brain that controls movement, typically the cerebral hemisphere opposite the weak arm, being attacked by a lack of blood supply. When a blood vessel is blocked, the signal from the brain can't get through, causing the muscle groups in the arm and hand to lose their normal function. Medically, this condition is called hemiparesis, and it is one of the most reliable signs of a stroke. Many people often rationalize it by thinking, I must have slept on it wrong, and my arm is numb, or I'm just so tired that my arm is temporarily weak. But there is a big difference. The numbness from sleeping in a bad position will usually disappear quickly after a few minutes once you change your posture. When the cause is a stroke, the weakness or paralysis persists, doesn't improve, and even tends to get worse with every passing minute. Remember, if you or a loved one is suddenly unable to lift an arm to shoulder level, or if one arm drops when they raise both, do not wait. This is not a trivial sign. It is a warning that the brain is suffocating. And with every minute that passes, millions of nerve cells continue to die irreversibly. In these situations, calling emergency services immediately is the only right thing to do. Don't try to massage the limb, and don't wait for a spontaneous recovery. The earlier you act, the higher the chance of a full recovery. Sign 6. Sleep apnea. While the sign of unusual arm weakness is easy to recognize in your daily life, sleep apnea is a silent enemy, often hiding behind what seems like harmless snoring. You might not even be aware that during the night, your breathing has stopped dozens or even hundreds of times. Each time you stop breathing, the oxygen supply to your brain is cut off. Your brain immediately enters a state of panic. It sends out an alarm signal, forcing your body to wake up briefly, causing your heart to race and your blood pressure to spike. But the next morning, you only remember that you slept poorly or felt tired, completely unaware that your blood vessels and brain were being tortured all night. The dangerous mechanism is this. When oxygen levels drop, the body responds by releasing a series of stress hormones like adrenaline and cortisol. These hormones constantly erode the vessel walls, making the blood more prone to clotting. And this combination of high blood pressure, damaged blood vessels, and the risk of clot formation turns sleep apnea into one of the leading risk factors for stroke, especially in people over 60. The alarming part is that most patients are completely unaware they have this syndrome. They just notice that they snore a lot, wake up frequently at night, or are always tired in the morning. Some people only find out when a partner sleeping next to them says they stopped breathing for a few seconds and then gasped for air. And it's this silence that makes sleep apnea more dangerous than any snore. Sign 7. Thunderclap. Headache. If sleep apnea is a silent enemy, a thunderclap headache is a lightning-fast, violent, and unmistakable attacker. Imagine this. You're in a deep sleep, but you suddenly wake up with a pounding headache. It's not a dull ache or a fleeting pain. It's a severe, dizzying sensation, as if a bolt of lightning just exploded inside your brain. Patients often describe it as the worst headache of my life. And there's a good reason for this, as it could be a sign of a deadly event, a brain hemorrhage from a ruptured aneurysm. Deep in the brain, some blood vessels are weak and swell over time without us knowing. They are like ticking time bombs quietly residing in the skull. When the vessel wall is under too much pressure, it ruptures and blood spills into the brain tissue or the subarachnoid space. The result is a rapid increase in intracranial pressure, which compresses nerve cells and causes them to die off in a flash. The thunderclap headache is the explosion that signals this bomb has gone off. The danger is that many people who experience this severe pain choose to take painkillers, lie down to rest, or even worse, take aspirin. But this is a fatal mistake. Because aspirin is a blood thinner, it will worsen the bleeding in the brain. The golden window to save a person is only a matter of minutes. If you hesitate, the risk of death and permanent disability is extremely high. Sign 8, the last time you were normal. Imagine you wake up in the morning and realize one arm won't lift, or your smile is crooked. At this point, no one knows exactly when the stroke began. It could have happened just a few minutes before you woke up, or it could have started silently in the middle of the night. And the difference of a few hours is the deciding factor between a nearly full recovery and living a lifetime with permanent disabilities. The reason lies in modern treatments. For strokes caused by a blockage, doctors can use thrombolytic drugs, a type of medicine that breaks down blood clots to restore blood flow to the brain. But this drug is only safe and effective within the first 4.5 hours from the onset of symptoms. After this time, the risk of drug-induced brain bleeding outweighs the benefits, and the patient loses the opportunity to use it. Additionally, in some special cases, doctors can perform a mechanical thrombectomy to remove the clot. But the prerequisite is still being able to determine the time of onset. This means every minute is precious. Even if the symptoms seem minor or go away on their own, don't wait to see if they improve. Act immediately and give the doctor the most accurate time information possible. Because sometimes, just by remembering the last time that person was normal was 10 p.m. last night, instead of a vague, "I think they were fine last night," you can open up a life-saving, brain-saving treatment opportunity. Sign 9, asymptomatic atrial fibrillation. After talking about the factor of time, the golden marker that determines survival in an emergency, we come to another sign that is just as silent and dangerous: atrial fibrillation. Have you ever felt your heart suddenly beat out of rhythm, as if something was gently fluttering in your chest before disappearing? This sensation lasts only a few seconds and is sometimes so fleeting that you ignore it. But in reality, it could be a sign of atrial fibrillation, AFib, a common heart arrhythmia in people over 60. And the scary part is that AFib can be completely asymptomatic. Normally, the heart contracts in a steady rhythm, pumping blood to nourish the body. But with AFib, the atria, the two upper chambers of the heart, don't contract rhythmically. Instead, they flutter chaotically, causing blood to pool and swirl. This stagnation creates a perfect condition for blood clots to form. And when a blood clot travels to the brain, it can block the nourishing blood flow, causing a stroke in the blink of an eye. The risk is not small. Studies show that people with AFib have a risk of stroke that is 5 times higher than that of a healthy person. And strokes caused by AFib are often more severe and more likely to leave permanent disabilities. Unfortunately, many patients don't know they have the condition because AFib can come and go, sometimes only revealing itself through a temporary feeling of palpitations or shortness of breath that no one pays attention to. Sign 10, severe dizziness. If AFib is an enemy hidden in the chest, this final sign directly attacks our balance. a natural ability we often take for granted. Try to imagine this. You're getting up from bed, and suddenly the room around you starts spinning like a roller coaster. You feel dizzy, nauseous, or even vomit, and you can't stand steadily. Many people simply think, it must be orthostatic hypotension, or I have a vestibular issue. But if this dizziness appears suddenly and severely, especially if it's accompanied by double vision, slurred speech, or difficulty swallowing, it could be a sign of a stroke in the cerebellum. The cerebellum, located at the back of the brain, is responsible for maintaining balance and coordinating fine motor movements. When a blood vessel supplying the cerebellum is blocked or ruptures, the signals that control balance become chaotic. The result is that the body loses its sense of direction, making it impossible for you to walk straight or even sit still without everything spinning. The danger is that many cases of stroke-related dizziness are mistaken for common vestibular disorders. This mistake is extremely dangerous, as a cerebellar stroke can progress rapidly, causing swelling and compressing the brainstem, the area that controls heart rate and breathing. If not treated immediately, the patient can stop breathing or die. You've just gone through the 10 early warning signs of a stroke with me. From sudden vision changes, slurred or garbled speech, a crooked smile, to a severe thunderclap headache or dizzy spells that make you unsteady. Each sign is a reminder of how fragile and precious our brain is. If you found this video helpful, please subscribe to the Senior Health Guide channel and turn on notifications. Here, we always bring you and your family important medical knowledge, explained in an easy-to-understand, relatable way, so everyone can protect their own health. And most importantly, please share this video with your family and friends, because by knowing these signs early, one day you might be able to save the life of someone you love.